up, Donna. Hello there. I'm trying to get to you. Hey, Kaylee. Hey, Donna. What you guys up to?
Sterile techniques. Whenever invasive procedures are to be performed, caution must be taken to maintain sterility. Some medical equipment is intended to be disposable while others are to be reused.
It's going.
Reusable equipment must be disinfected or sterilized accordingly prior to being used with each patient. Reusable equipment includes some surgical instruments, clamps, forceps, some scalpels, and endoscopes. All reusable medical devices can be grouped into one of three categories according to the degree of risk of infection associated with the use of the device. Critical devices, such as surgical forceps, come in contact with blood or normally sterile tissue. Semi-critical devices, such as endoscopes, come in contact with mucous membranes. Non-critical devices, such as stethoscopes, come in contact with unbroken skin. Take note. Sterilization is required for all instruments and equipment that will penetrate a patient's skin, enter a patient's body, or come in contact with any other normally sterile areas of the body. Sterilization is also required for all instruments that will be used in a sterile field, even if they will not be used on a patient.
Yeah, that's a whole lot.
An item is considered either sterile or unsterile. If in doubt, consider it unsterile. Equipment should be sterilized according to manufacturer's instructions. To minimize risk of infection, some medical equipment and supplies are to be disposed of after a single use. This includes needles, syringes, sterile gloves, gowns,
314 subs. That's wonderful.
Since they will be entering the patient's body, needles must be sterile when used for injections. According to the Centers for Disease Control and Prevention, CDC, unsafe injection practices that have resulted in disease transmission have most commonly included the following: using the same syringe to administer medication to more than one patient, accessing a medication vial with the syringe that has already been used to administer medication to a patient, then using the remaining contents from the vial or bag for another patient, using medications packaged as single dose or single use for more than one patient, failing to use aseptic technique when preparing and administering injections. Needles come individually wrapped. Check the expiration date on the wrapper to make sure the needle is still in good quality. In rare cases, old needles may bend or break. Take care to not place the exposed or uncapped needle on a tray or countertop. A clean needle may be recapped for protection prior to injection using a one-handed stick method. However, caution should be used since contamination by an incidental stick is possible while recapping.
Also, I got my other phone.
Injection is an invasive procedure. Swabs are necessary to wipe off vials or wrap around the neck of an ampoule, as well as for skin preparation.